What's up? It's Way Up with Angela Yee, and we are blessed to have Dr. Katsnelson here with us today. And you're the CEO of the USA Fibroids Centers, and fibroids is something that has been a topic on this show for years. It's something that I know a lot of women who have suffered from fibroids. We've talked about how diet can affect fibroids. We've talked about how it affects women of color, of Hispanic women and Black women more than it affects other groups of women. And so we have you here today to give us some insight, because I learned about something from you that even though I've been talking about fibroids for years, I didn't know about. So let's start from the beginning about what fibroids are.
Good to be here. Thank you for inviting me.
Thank you.
Fibroids are a very common disease. It's basically a tumor, benign tumor, a growth in the uterus. That irritates the uterus and creates very common symptoms of prolonged heavy menstrual period or pressure on other organs. Can be 1, can be 20. They can be small or can be as large tumors as a grapefruit, but they're benign tumors. They not create cancer, but they can ruin their lives.
Right. I knew a woman one time, we had her on the show. She had over 50 fibroids, and it was so bad that she literally couldn't leave the house. Like, she was bleeding nonstop. It affected her dating life because she didn't want to date anybody because of the heavy bleeding. It affected her weight. It affects your confidence. It affects your ability to be able to go out and work when it's extreme, the way that it was for her. And sometimes people don't know that they have fibroids. So how would a woman know if she's paying attention to her body? There's something wrong here, because sometimes you think you just have a heavy period. People think, I have a lot of cramping, my period's just heavy.
Angela, you know a lot about fibroids. So when 80% of Black women and 70% of white women will develop fibroids by age of 50, it seems like everyone has it. Mm-hmm. And it's absolutely true. It's difficult. It's a progressive disease. It's not like one day you have a severe pain in the belly. It's progressing. You have a bad period, then worse period, then longer period. So I would say, let me just tell the symptoms first. How do you know? And after that, how do you know where to search for the doctor or treatment? So the symptoms are basically two types of symptoms. One is a bleeding. Heavy, prolonged bleeding between menstrual periods, continuous bleeding. Some women bleed 1 week, 2 weeks, and almost all the time. Mm-hmm. They bleed so much that they lose hemoglobin. Blood becomes thinner. It's called anemia. They take anemia medications, iron supplement that cause constipation and many other things. Some get iron transfusion. Some get blood transfusion. When you bleed, that it stops your life from normal functioning. When you bleed that doctor says you have anemia, it's highly abnormal. Mm-hmm. It's definitely not normal. It's definitely disease. Other types of symptoms, it's symptoms of pressure, because it's big, right? Mm-hmm. It presses on all other organs. It can be small bladder symptoms, but women runs to the bathroom all the time to pee. It can be constipation. Can be pain during the sex. None of it is normal. If women experience any of those symptoms, search for help. This terrible symptom, terrible presentation of disease, unfortunately, is called miscarriages. Mm-hmm. Fibroids are number one reason for losing babies.
Oh, wow.
Because if you think about this, it competes with baby for blood supply and space in the uterus. So many women learn about fibroid disease when they have miscarriages. So fibroid is terrible disease that ruins someone's life, and ruin not only physically, but mentally. You cannot be in the right place in your head when you suffer so much. Socially, cannot date, cannot go out. Family-wise, if you don't go out, don't conceive, or you have miscarriages, you don't have normal family, don't have babies. Economically as well. If women suffer so much, cannot benefit from education, go to college or get a good grades or go to work. Most people work on the hourly wages. Right. You don't go to work, you don't get paid.
Or you have to call out, and then I know women who literally will not leave the house because they have their period, and it's like you said, it is very crippling. It can prevent you from doing a lot of different things. And we talked about miscarriage just now. What about affecting your fertility? being able to even conceive, get pregnant at all.
Absolutely. The fertility and success, the fertility is a big problem with the fibroids. And we spoke a lot about bad things. Mm-hmm. There are good news too.
Okay. We want to hear some good news.
Some good news for a change. So fibroid diagnosis is very easy because it's a tumor, right? It's like a ball, right? Inside so you can see it very well. It's not mystique. It's not maybe. So when we do ultrasound, transvaginal, transabdominal ultrasound, which is no radiation, very easy study, like a pregnancy ultrasound, we'll be able to see fibroid, 1 or 20 sizes. Rarely we need to do MRI. Mm-hmm. Also, study that doesn't require anything. And then we can see the fibroids and we can treat them. Now, the treatments, the one thing that most people don't know, and you didn't know,
right,
about uterine fibroid embolization. So typical treatments of fibroids are do nothing, or maybe some pain medication or hormones or, iron supplement medications. Do nothing. It's a terrible idea.
Right.
20, 30 years of life
just
will be...
suffer.
Just suffer. No fun. Second is myomectomy. Myomectomy is removing the tumor. But how do we get to the tumor? Oh, you need to open like C-section, basically like flare the steak and scratch it. Scrape it.
It's really painful.
Really painful. And then recovery. And it's a big surgery. And the third one, variations of hysterectomy. It's ultimate solution. Right. Eviction. Nothing good about this. It's women don't understand what happens after hysterectomy. Uterus is actually a very much needed organ for many things. First of all, one thing is it holds bottom of the body. So if you remove the uterus, everything will fall down.
Ooh.
So you can have a prolapse. Vagina can prolapse, the bladder can prolapse, the rectum can prolapse, and you have incontinence. That's nothing wrong about, nothing good about this. So when women say, oh, take it lightly, let's just remove the uterus and the period.
Wow.
That's not a good idea.
Yeah.
Next, during the orgasm, there are contractions of the uterus. No uterus, you understand, sex life is not the same. Also, it's pretty painful. So 9% of women end up with a dependency on drugs, long term.
See, I just always think hysterectomy, you can't have kids anymore, because that's one of the things, I didn't know all of these other things come with it, because I know women have had to make decisions about whether or not, like a doctor would be like, you have to just get a hysterectomy. And then women are like, I want to be able to have kids one day. And I know that is also one of the symptoms from that, right?
Correct. So that's why, the conversation is really black and white,
Right.
I would say black and, bad and bad, because either you suffer or you remove when you don't want a kid. But the good news, there's a solution that's been around for 25, almost 30 years, called uterine fibroid embolization. So it's a minimal invasive treatment through the needle hole, just right here, needle hole in the wrist or in the groin, that we thread the catheter that goes, through the blood vessels to the beginning of the blood vessels that feed arteries that feed the uterus and fibroids. When we block blood supply to fibroids, they shrink and die, shrink and get absorbed by the body. Like weeds, in the grass, you stop watering the lawn and weeds are
shrivel
dying.
Up and die, right?
Correct.
Okay.
Procedure takes 20, 30, 40 minutes. Done in the office, 2 hours later, patients will go home. So now you heard about, we discussed suffering.
Uterine fibroid embolization.
UFE, uterine fibroid embolization. Embolization is clogging the artery, clogging the blood vessel, stopping, closing the faucet, basically. So when you close the faucet of blood supply to the fibroid, the dying disappear. That's all. And women can have normal fertility and deliver babies. And there are multiple studies that show women fertility rate is much higher after UFE, after this treatment.
That makes sense.
Than having fibroids.
Let me ask you this. So why is this something that's been around for, like you said, over 20 years, but it's not something that's widely talked about?
It's a great question. That's the question that could have saved millions of women, tens of millions of women over time, and create generations of babies. The treatment was approved by FDA in 90s. So, strange answer I'll give you.
Mm-hmm.
Because women go to the wrong doctors.
Okay.
So when women have a disease, related to female problems, they go to gynecologists, right? Mm-hmm. Gynecologists don't do that. They have myomectomy or hysterectomy.
Okay.
So when you go to a gynecologist, you get what this doctor does. And uterine fibroid embolization is done by interventional radiology. It's a relatively new specialty. Mm-hmm. Many people don't know about this. But the specialty is, through the catheter, reach almost any organ and treat almost any disease. That's interventional radiology. So there were many studies in medicine that in case of multiple treatment options for the same disease, the recommended treatment will mostly depend on the specialty of the doctor.
Right.
I wish it would not be the case, but it is. So how do we solve it? Mm-hmm. Education. Women need to know that they don't need to suffer, and there's a uterine fibroid embolization. Like we know about breast cancer screening, colonoscopy. And why is it a disease that affects maybe 25, 40 million people?
So many people.
So many
it's ridiculous.
People. 80% of black women, 70% of white women. It's such a common number one disease for women, and nobody talks about it.
Yeah. I think that women tend to think it's just normal. I just have a heavy period. I just bleed a lot during my period. I can't do anything while I'm on my period. And it's become so normal to think of it that way.
Women are tough.
Yeah, we are.
They go through a lot.
Now, I do want to know, because I know my listeners are going to be thinking the same thing. So what are some of the risks that are involved? Because obviously with everything, there's some type of level of, okay, this could potentially happen.
Risk?
Involved with uterine fibroid embolization.
So when we do big surgery, a big incision, there's many risks because we cut, we touch many organs, and then there are plenty of complications of myomectomy, hysterectomy, bleeding. When we have a needle hole in the skin, the risk of any complication drops dramatically.
Okay.
Obviously, people need to know what they're doing and go with the catheter to the right place. But that's basically why is that drastic drop in risk. For example, when you do heart surgery, it's a big incision and a big heart surgery. At the same time, the same disease, blockages in arteries, can be treated with stent. Everyone knows, a needle hole. Very, very different risk. The recovery after uterine fibroid embolization is 2, 3, 4 days with cramps. Okay. So some women, if we deprive fibroids from blood supply, they're a little disturbed, right? And they feel a little pain, and as they shrink, they have these cramps. And that's very similar to menstrual period cramps.
Right, so you'll see it coming out of you like when you have your period, more like blood clots as it's passing through your body afterward?
It's mostly just cramps.
Mostly cramps?
Mostly cramps, yeah.
Okay. And then what about fibroids do tend to come back, right? We've heard of people getting even a myomectomy, getting different things done, and the fibroids returning. And so is that also something that would potentially happen?
Great question. Fibroid returns because myomectomy, most of the time because not everything was removed. Think literally like a steak, right? Can be on one side, on another side. Inside, they're not always visible. And when you scrape, some can be, some can remain. And new fibroids can come. With the uterine fibroid embolization, when we decrease blood supply, it doesn't matter whether it's 1 and 20, it shrinks all of them.
All of them, okay.
All of them. So it's much more definitive treatment. There's a possibility of recurrence, but comparison, in myomectomy, in 2-3 years, about 50% of recurrence.
Yeah, I always hear that. They're like, I just have to go back again.
In 2-3-4 years. And UFE, we had to repeat UFE 1.2%. basically 1%.
Okay, that's great. Yeah, because I know sometimes they also won't, they'll just take the biggest ones out. And like you said, this will reduce all of them and shrink all
Doesn't
of them.
matter how
Sometimes
many.
they're like, we'll just get the big ones and then the smaller ones aren't a problem, but then they do end up being a problem.
Of course, because they grow.
And what about the cost, right? Does insurance typically cover UFE or what's the deal with
It's great news. Insurance were covering for many, many years, for decades. Insurances cover, managed Medicaid covers, managed Medicaid covers, and most states, especially New York. So it's basically, it's all covered by insurance. Because insurances understand that that's a medically needed procedure, so they cover the treatment. The only thing insurances don't do, and I think we can convince them eventually, when insurances have internal guidelines for what are the options, they list all of them: do nothing, hormones and pain treatments, myomectomy, hysterectomy, UFE, or like all equal. So if you will have a pain in the finger, it's like do nothing, take Tylenol, remove the finger. It's okay.
Right.
It's
Let's not
obvious,
remove
not
the
the
finger.
same.
Yeah.
But in the guidelines and medical guidelines, it's or like there's no difference. And because it's not as obvious to everyone that it's not the same, it goes, So those things that we all need to change eventually and say that before you do anything such a drastic, like removal uterus, you need to consider minimal invasive and fertility-friendly options like UFE. And if women will know what is UFE, that it's a 30-minute procedure, 30 to 60-minute procedure in the office, hour, 2 hours later you can go home, covered by insurance, and immediately regain normal life, I think...
Yeah, it actually makes fibroids seem not so scary. When
That's
you
exactly
hear about it like that. And I do want to ask one last question. So afterwards, say you have the UFE and you're like, okay, I feel much better. Should you change anything? I know we've talked a lot with one of my friends, Coach Jesse, about diet and how that can also affect fibroids. Because a lot of people don't understand, how do you even get fibroids in the first place? So what are some things that you would say when it comes to that? Because I don't know how somebody gets fibroids. So many women have it. Like you said, black women, 80% of black women will have fibroids.
We're on the same page. I don't know either.
Okay.
Nobody knows. Yeah, nobody knows why. I'm sure it's genetic and hormonal because it's very, very common, and certain types of women get it more than others and get it early. Black women not only more often get also early and much more symptomatic. So there's a definitely genetic, but specifically, we don't know who will develop.
Right.
But the good news, you can get rid of them within an hour and not to suffer 20, 30 years.
Ooh,
and have
great.
the best version of your life. And I would like to imagine life without fibroids.
Yeah.
So, and we have an example. If someone has a crooked teeth, right? Nobody is born with a perfect teeth. But everyone in high school, almost everyone has a perfect teeth. And whether they're crooked or straight, you can chew the same way. Because we know, it's covered by insurance. You go at the dentist, they will just fix your teeth, right? So I think women need to be very confident. If they have a fibroid disease that affects their life, they just need to call USA Fibroids Centers or interventional radiology or gynecologists and ask for UFE. So they don't need to suffer, get rid of the disease, and have wonderful life.
Is this also a treatment you can do while you're pregnant? Because women also can have fibroids while they're pregnant, and that can also cause a really uncomfortable and painful pregnancy.
Cannot do it while they're pregnant.
Okay.
But we can do it before or after. And again, to remember, after fibroid, after UFE, women can be pregnant, and the rate of pregnancy is higher than before when they had fibroids.
All right. Well, Dr. Katsnelson, I know you have work to do, so I appreciate you for coming here and having this conversation, because I know this is something we have like whole shows dedicated to this a couple of times a year, because a lot of the people who listen to this show and who I come across in my everyday life, these are real conversations of things that affect us. So I appreciate you for bringing something to my attention that I didn't even know about, and I want to make sure that everybody's aware.
Thank you very much, Angela. And please, you can check usafibroidscenters.com, usafibroidscenters.com for more information.